Welcome to The Bridge, Your Health, Your Voice, the official podcast for the University of Maryland, Baltimore School of Pharmacy Patients Program. The Patients Program is the bridge between the community and researchers. The Patients Program created this partnership to help researchers listen to the community's voice in order to build a bridge to an effective learning healthcare community. Here's your host, Rodney Elliott.
I'm here today with an important guest, a partner of the Patients Program, a friend of the Patients Program, America Islas. Did I say that last name correctly?
Yes, that's correct.
I like that.
Yes.
I like to kind of roll the S a little bit. By no means I speak no Spanish at all, but I like to roll my S's every now and then. So good to have you. America, we're going to talk about a couple things today on the bridge. You've joined us, particularly with the Co-Pillar Project. You've been a part of the committees, you've been a part of the meetings, and from outside looking in on some of those meetings, I really appreciate your contribution to those meetings because you have shed a light on the stuff we're talking about from a perspective that sometimes it goes unheard sometimes. And here at the Patients Program, we find ourselves advocating for the voiceless or folks that don't have a voice at all. And when we have community members and partners and patients and folks who are confident and folks who are genuine about their work they do, and as far as advocating is concerned, we welcome that with open arms. Before we get into our questions, you mind sharing with our guests a little bit about who you are and what you do?
Yeah, thank you. Again, my name's America Islas, pronouns she, her, ella for those that speak Spanish. I do speak Spanish, Ronnie, so I like to include my Spanish pronouns in there. A little bit about what I do is I do hold, I'm a licensed marriage family therapist.
Yeah.
I used to provide therapy services to Latinx folks, so I used to do therapy in Spanish. I now am a program director for family builders. I also I consult. I do trainings around LGBTQ plus topics. I'm also part of the LGBTQ plus community. Have a beautiful wife and two beautiful kids. So I like to consider myself an advocate and activist for the LGBTQ plus community. And my passions and my heart are to be of service and provide better services for my community and get back in that.
Thank you for sharing that, and I appreciate your transparency. And when we talk about, being an advocate for any group, my first question, America, stems from, how can mental health advocates support the unique challenges that are faced by the LGBTQ plus community, and what are the initiatives that are most effective that works, basically?
Having worked with LGBTQ plus folks, Ronnie, and being part of the community, I feel like I know it firsthand and have been that provider on the other hand, where I've noticed that we as providers, we think or we try to be the best affirming safe space for our community, right, and our community members. A lot of the time we come from a good place in our heart and want to be that person of service, that first person that can welcome our community. But sometimes we fail at that. I failed at that multiple times, and I'm part of this community that I love, and I'm so passionate to serve. But I think having kept in mind that being part of the LGBTQ plus community, we're already feeling a little bit hesitant to receive services or not feel like we're going to be noticed or given that space to have a voice or be affirmed because we might not know that other person on the other end providing us services, are they affirming? Are they are they going to welcome me for who I am authentically? So we tend to put up a wall. And in order for us as mental health advocates to be able to support our LGBTQ plus community, I feel we need to be a little bit culturally humbled, right? That cultural humility, where we need to meet people where they're at, not be afraid to ask, hey, Ronnie, what pronouns do you use, right? Of just giving that space to folks to really identify how they want to identify. And, I think that all as well, it's a community that suicide rates are super high because they can't be their authentic selves. So just keeping that in mind of how can I be that extra safety net or extra support, provide that extra support for our community of just letting people know, like, hey, I'm here, and if you need something and I can't find it, like, I'll help you find that resource, even if I'm not part of the community, or even if I'm not an expert or don't work with LGBTQ plus folks. Like, I will still be there as an ally for you.
Did a little research, America, and in some of your previous work, I read a quote where you said you again wanted to provide spaces for folks to be their genuine self. You wanted to provide spaces for folks in the LGBTQ plus community to be their genuine self. Here at the Patients Program, we focus a lot on the 4 pillars of health: physical, mental, spiritual, and financial. Not necessarily in any order, but when you talk about being the key person that kind of provides that space, can you share with us a little bit from that perspective of, in your experience, what are the key mental, physical, financial, and spiritual health disparities within the LGBTQ plus community, and how can awareness be raised to address them? Not necessarily in no order, but what are some of the challenges that the community faces when you talk about those 4 pillars of health?
Yeah, thank you. That's a really great question. Song for health, the LGBTQ plus community, I think we fear of rejection, fear like we don't have support systems around us, fear that we can't receive gender affirming care, because we don't know if providers are going to be able to like address us the right way, or connect us to proper resources, or do their beliefs match with our beliefs, right? And how we're living our lives. So around the health topic, I feel a lot of us don't get the proper health or proper services through our providers, because we don't have these open conversations. Our providers don't ask us, like, they just maybe assume I'm in a heterosexual relationship and always ask me, like, is there a possibility of being pregnant? Or when you haven't even asked me what my sexuality is, or am I in a same-sex couple, or so I think certain questions that even like health providers ask us in trying to support us in our health, I don't think that they're very open to, or very affirming in that sense. But when that can help, if just even saying, hey, are you in a same-sex relationship, or you romantically attracted to, like, we're afraid of asking those questions, Rodney, and I think they're very important.
So when you say we are afraid to ask those questions, are you specifically talking about the doctors, the nurses, or like
I think it's a full circle, Rodney. Even with the first contact, you walk into a doctor's office or a therapist's office, and if somebody's at the front desk checking you in, they might see your name as America on the schedule, but do they even say, hi, America, like, my pronouns are she, her, yeah, how would you like me to address you? It starts with the first contact, right? That's how people start feeling safe. If I don't, for example, like, if I go to a coffee shop and I see a rainbow flag outside, I know that that's probably going to make me feel more safe, more welcome, because they're not asking me my pronouns, but they're showing the community, like, this is a safe space. The same thing with, like, anywhere where we're receiving services, whether it's mental health, even a bank. You talk about being the financial part of that. I can share that I've worked with a lot of same-sex couples that want to buy a house with their partner, and they don't know real estate agents who's LGBTQ plus affirming, or don't want to say that they want to see this house with their partner, or they go into a bank wanting to take out a loan, but we as a community are afraid to share that, because we're not going into spaces where conversations are being welcome around our sexuality, gender identity. And that can make a difference. It can make us feel like we belong in this community.
America, that reminds me of, sometimes when I meet with community members and researchers, and we're collaborating on the project, and sometimes some of the community members, I'll let them know that, hey, you're going to be in a meeting, or you're going to be in a Zoom, or you're going to meet with the doctor. You're going to meet with not the doctor, you're going to meet with the researcher, the principal investigator. And sometimes they may see all the letters on the end of their name, and they kind of get a little intimidated a little bit. And I shared with them, I said, yes, those doctors are professionals in what they do. They went to school, they got the degrees, that's great. But you, as a community member, are an expert in your lived experiences as well. And we want to give you that same confidence that they have, and education that they received from their tutelage. that you have from your tutelage out in the community. So I understand how if you want to continue on and buy a house or get a loan or even have a cup of coffee, you want to be welcomed just as who you are in a genuine way. So I totally understand that. But when we talk about societal attitudes and, when discrimination comes into play, how can advocates work towards creating inclusive environments? Because when I do encourage community members to participate with these doctors, I want them to let them understand that, hey, you guys are on the same playing field, right? How can advocates work towards creating more inclusive environments for the LGBTQ plus community?
Yeah. I talked about cultural humility a little bit, right? We hear it. We used to hear it as cultural competent, being able to relate to people or understand people's narratives and stories. But cultural humility, it's just putting us all on that same playing field, Ronnie, right? We're all human beings first, aside from the letters after our name or titles or whatever you want to call it, right? But I think being able to acknowledge hey, we're all part of the same community and we all need to unite in order to feel that way. And that's cultural humility for me. You're saying how can we provide more inclusive environments? It's by meeting people where they're at, ultimately, as simple as that sounds, to be honest with you. We can't, be able to be the same and hold hands at that level. We're always going to have these different steps that we're taking role in. And I just really, I encourage everybody to be more open about hearing people's narratives and their stories and where they come from, in order to really not understand people, but really just be compassionate of where people are coming from in order to really hear what are your needs, right? Because I don't have all the answers, Ronnie, neither do any of the professionals that are providing these services. So like you said, it's community members, it's our communities that we're working with that should have that voice, should have let us know, but we can't ever hear that if we're not meeting people where they're at. As simple as that might sound, we're not doing that.
Meeting community members or meet people where they at, that is kind of like second language to folks here at the Patients Program. We say that all the time. And you're right. People kind of don't get that. They don't understand that it could be literally mean coming out into that community. It could be mean turning your listening ear on a little bit more when you're talking to a community member or when you're talking to someone who's speaking from an advocate position or on behalf of a specific group. You've been with the Patients Program for a while now, and I speak highly of the Patients Program because, hey, I'm a part of it. I've been here for 6 years and some change, and we find a way to provide spaces where we do have that bi-directional learning. It's another terminology that we use here in the Patients Program, where you get two folks, two groups, or two people, or two organizations in a room, in a Zoom or in person, and you guys have a conversation. You talk about things, you share things, and that's important. Can you share some examples of some successful programs or interventions that have positively impacted the mental well-being of the LGBTQ plus community? And then what lessons can be learned from them? Because we're all about learning. We're all about learning lessons. This is what the Bridge was kind of created for, this podcast here. We want to bring information to the community, but we also want to provide topics for people to have a conversation. You don't have to necessarily agree on everything, but we should at least listen to it a little bit.
Yeah, I can share with you. I work part of the Youth Acceptance Project through Family Builders, and what that is which is a great intervention, and it's meeting people where they're at. So in order for youth or kids who are identifying part of the LGBTQ plus community, what the Youth Acceptance Project does is we have a family advocate, we call ourselves. And what we do is these kids get removed from their home because their family is not being accepting of their gender identity, sexual orientation, or gender expression, or they're identified part of the LGBTQ plus community. So what we do is we come in, we work with the families, rejecting as they can be, as homophobic as they can be, and we really meet families where they're at, right? So we sit with them, we cook dinner with them, we go to the grocery store with them, just to be able to hold these conversations and be in community with them, to see and really bring compassion to what their journey has been and where they're at with trying to love and care for their kid. And a lot of it, we have learned that it's not that families don't want to love their kid for who they authentically are, is that culturally they haven't been taught how to love a kid who's LGBTQ plus, or their religious, their church family. It's not accepting, but they don't know that there is another church, like Unitarian Church, who talks about loving your LGBTQ plus kid. So I think it's a lack of information that families don't have, a lack of support. We already live in a society that's a lot of pressure around how to dress, who to be, how to act, who not to talk to or who to talk to, that being this family advocate for them and allowing them that space to really just share their raw feelings about how it is to have a kid who's LGBTQ plus and how hard it is for them and their family, and feeling alone in that process, having that one person can make a difference. And we've gotten kids back, the kids have been removed from their home, and in the foster care system or in the system, like we've been able to bring them back home to a loving, affirming home just by working with the caregivers and providing that support, giving them that safe space to talk about, no judgment, and providing those resources to the family members of the kids. So that's been a really heartfelt experience for me. And the services are there. We just don't know about it.
That's great, America. And I'm going to actually ask you to share some of those links or resources here on the bridge for some of our listeners, because just yesterday I was out and met a gentleman who works at a school, and part of his role at the school is also talking to kids when they might not be having the best day in class. They come to him and they talk to him. And this one particular situation was he's dealing with a young man who family isn't accepting of his expression, and he's having challenges in school. And he basically said that the resources aren't necessarily available. And that just kind of stuck with me when you just mentioned that. It's funny that you just said that. And I had an instance yesterday, and when I go out sometimes to talk about events that we're having for the patients program or things coming up, sometimes folks just share with what they have and what they need. And, if I can help some kind of way fill a gap, or maybe pass a link to someone that can, maybe get some information, that's part of my job as well. So for those listeners here, be on the lookout for some links, information from America that possibly can help folks navigate family issues and family concerns. How has your experience working with the Patients Program been so far?
It's been amazing, Rodney. I've had the opportunity and been super grateful that you all have allowed me the opportunity as well to be part of the Patients Program, and be able to join our meetings and be able to just even hear about community members and the services that you all provide. As well, it's a piece of my heart that I think had not been felt before in my different roles, in a way where my purpose here is to be able to give back to the community. And I haven't had that in other jobs that I had here, even if it is very limited time. But I've been able to have a voice here at the Patients Program. I've been able to give feedback. I've met a lot of peers, community peers, professionals that I've been able to connect with outside of our meetings. And it's nice to be in the same space where everyone has that same passion. Those spaces are very limited, Ronnie. So I value those very much, and it's super grateful that y'all have allowed me a space here to be able to do that with all of you.
America, I really appreciate it. Thank you for the kind words. And for our listeners out there, you tuned in early and heard that my Spanish is zero. I have no Spanish. I just roll S's really well. America is bilingual. She does speak Spanish, and we will have a Spanish edition speaking to America. So the listeners who don't speak English can hear what America has. Here's some of the resources that are available. But more importantly, again, you talk about meeting the community where they are. The Spanish community is just as important to us as well. So be on the lookout for information on that from the bridge, from America. And that's going to be led by one of our members of the Patients Program who speaks English, Michelle Medeiros. So if you listen out there, Michelle, got to brush up on your Spanish so we can have an awesome show like this one. I'm not competing against you, Michelle. This is not a whose show was better. Not at all. It's just a matter of, again, providing this space for our listeners. America, I really appreciate your time today. I know it's a little early over there for you on the East Coast. And when we get finished, if you can mail that sunshine or send that sunshine over to the East Coast, we'll greatly appreciate it.
Will do. Thank you, Rodney, for your time.
Thank you for listening to The Bridge. Your health, your voice. To learn more about the Patience Program, visit our website at www.patience.umaryland.edu.